Okay, there we go. All right, it's 2:02, so I guess I'll just get started. Yeah, welcome everyone. Today is our November Health Policy SIG meeting. I'm just going to start off with a couple of announcements. So we're still looking to recruit another co-lead for the SIG for next year. So if you're interested or know anyone that might be interested, please let us know. I'm going to put our email in the chat. But basically, it's like a 3 to 4 hour a month time commitment. There's a lot of benefits from doing it. You can feature people whose work you find interesting. You can feature your own work. You can build stronger connections with people in the society. I found it to be really a great, enriching experience to develop some relationships with people in the SIG and in the society. It's a good CV booster if you're like an early career person. So if you're interested, please send me an email at this healthpolicy@systemdynamics.org email. Also, if you're a professor and you have students that you think might be interested in that role, please let them know about that and yeah, have them reach out to us. And then what else do I have? Oh, yes. I don't have anything scheduled for the sort of spring lineup for presenters. So if you have something that you'd like to present, or you know a presenter that you'd like to see present at the SIG, also please email me at that email address. What I'm planning for the early spring, January, February, and March, are the work in progress sessions. So kind of to help people prepare for the ISDC 2025 submissions. So I'm going to be sending out an email probably within the next month for signups for that. That will be like a kind of 5-minute talk format where you can get feedback on your work at any stage in its process. So watch out for that. But if you have something that's maybe a little bit more polished and have enough material for an hour talk, let me know, and we can put something on the books for later in the spring. So that's all I have for housekeeping. So I'm gonna introduce our speaker for today. I'm just gonna read your bio, April. So April Roggio coordinates a multi-institution research team focused on food system localization. Her recent work focuses on the study of municipal interests in foodshed localization, participatory guarantee systems, collaborative governance, climate resilience in rural communities, and cannabis policy in New York State. She earned a master's in public policy and a PhD in public administration from Rockefeller College at the University of Albany, focused on the intersection of judgment and decision sciences using system dynamics modeling. And she is currently a visiting assistant professor at the University of Albany and a research associate with the Center for Policy Research. So we're very excited to have her today. She's going to be presenting on getting high in New York State, exploring equity and social impacts of cannabis legalization. So April, if you want to share your screen.
Yeah, thank you, Rachel. I will share, sure. I should have given you like 2 sentences, right? I didn't realize you would read it.
It's okay. It was short enough that I felt like I could just read it. So.
Let me see if I can make it. Okay, do you see that? You can hear me okay?
Yep, you sound good, right. And I can see it.
Awesome. All right. So, and please, feel free to interrupt me. I know people hate it when I don't hate interruptions. If I'm not being clear, let me know. And if it goes too long, cut me off. So thank you guys. Thanks for being interested in this work. This is some of the more interesting work that I've gotten to do in the last several years. Usually we're working at the intersection of policy and social implications of certain technologies and entrepreneurship and agriculture. So this was really welcome, and plus I really like the title. So see how it goes. All right, so first, you already said who I am. I just wanted to introduce some of my collaborators. So I'm working with two people, one of which is a stakeholder. So she's worked in the cannabis industry for years. She's worked for some of the big industry leads like Curaleaf working in cannabis. And she's also one of my valuable stakeholder contacts in New York State when we're working on agricultural issues. So that's Suzanne. And Jonathan McKinney is another partner of mine. He works at Rensselaer Polytechnic Institute in Troy, New York, next door to me. And his focus has often been on data management. So this has been kind of a fun project to introduce him to system dynamics modeling and be able to lean on him for data work. One of the more recent proposals we've written about this kind of work is to better understand how we can get adequate data to actually even make predictions or understand behavior better when it comes to cannabis. So, and I have to tell you, I'm really hoping to make this shorter than the conversation I've been having lately about cannabis. So I just want to sort of talk about 5 things. So I'll give you an overview of cannabis just generally, the policy, the implementation across states. And I'm mostly doing that because I kind of love it. Like this is an investigation into whether policy learning is actually happening or not. And then I'll show you some positive diagrams. We want to create simulations, and we're not quite there yet. So we have diagrams how we're mapping supply, demand, and price, how we're addressing law enforcement, how we're addressing both the quality and the potency issues in cannabis. And then some next steps, because there's been some interesting things that have happened even since those of you that I spoke with in Bergen. So I'll detail some of those. So first of all, the Marijuana Regulation and Taxation Act was signed into law on March 31st of 2021. It created the Office of Cannabis Management. It's overseen by a 5-member board. And it's also supported by this 20-member Cannabis Advisory Board as well. And one thing to really point out, and this is kind of key to a lot of the work that we've been doing really recently, is that there was this shift that happened, right? Legalization for New York represented this way of integrating public health, creating a really important public health framework grounded in the principles of public safety, of economics and social justice. And it really wanted to prioritize and try to repair the harm that has been inflicted on populations in New York State because of our cannabis prohibition laws. So often I like to start out by telling people where we are. So one of the interesting pieces of this work is that we promised record expungement. We have asked numerous times about the actual numbers of records that have been expunged. If you had a cannabis conviction, this law went into effect. If it was a misdemeanor, it was supposed to have been removed from your record. No one can actually tell us how much of this has happened. I kind of assumed it was automatic, and some of them may have been automatically expunged. Some of my friends in both system dynamics and data science have told me that I should be suspicious that actually happened in an automated way. Equity in the market, we really wanted to make sure that those people who had been unfairly criminalized because of cannabis distribution in the past were the ones at the front of the line when it came to receiving licenses. From a system dynamics perspective, what that actually has meant is that it delayed the licensing process tremendously in New York State. As of this morning, I can tell you that the community reinvestment piece of this is actually moving forward. So I recently got some emails from OCM saying that they're issuing a call. They want to figure out how we're going to handle the community reinvestment piece of this. And this is essentially, counties and communities are sucking in tax dollars. Some of those tax dollars are supposed to be used to actually reinvest into community initiatives. So I wanted to provide a little bit more context. So it's important to remember that the policy, of course, was crafted right with equity in mind, equity participants. We wanted to legalize rec cannabis. It tended to focus first across many, many states, legalization tended to focus on both regulation and the economy. In New York State, we aimed to do that a little bit differently, right? So CURD, and what that acronym means, is conditional adult use recreational dispensaries. They have also had conditional adult cultivators. It went a step further, mandating that the first licenses for the sale of recreational weed go to people who had or whose family members had a marijuana-related conviction. And this was done for very important reasons, right? So in the previous 4 decades, according to an analysis by the Legal Aid Society in New York State, police in New York had made more than 1 million marijuana arrests, although weed is consumed roughly in equal proportions across the racial and economic spectrum. As recently as the year 2020, people of color were subjected to 94% of marijuana arrests and summons in New York City, and arrests in the city were also much, much more likely to happen in very high poverty areas. So the idea of CURD, of the conditional use permitting process, was that we really wanted to create a situation where we were using legalization as a kind of reparation. And I have to keep moving where people are on my screen. So just to take maybe a little bit step back, I wanted to say that additionally, when we crafted this law, it was designed in a way that we could maximize or optimize for equity. Those of us who were in, I think, the ag kind of space, we were really excited to see this. So essentially what these tiers mean is that you can't cross over. So if you are a cultivator, if you're a farmer, you can't also be a dispensary. This is important in some ways because we knew about what had happened in other states where there were large, in my chart here, it's the registered organization. Those guys also tend to be multi-state operators. They're very large cultivators and distributors of cannabis. The goal in New York State was to not allow them to just simply take over the market. I think it's possible that it's still out, right? The jury is still out whether we've actually managed to make that happen. As of the end of last year, we allowed the big ROs to enter the market. It was designed from the beginning to give small farmers a head start. So as of the end of 2023, that head start ended. What we can say optimistically from my kind of ag-centric perspective is that it did not mean that the market was now flooded with Curaleaf dispensaries or Trulieve for any of the big operators. That could be because we didn't want that to happen. I think more realistically, that is because we're thousands of applications deep at the OCM, and we haven't managed to actually approve more than 200 odd dispensaries to begin with. So where else are we at? Part of the fun part of this project has been doing some of the data analysis. So on the left, this is a product of a complementary project that I was working on. We really wanted to just really understand the descriptive statistics behind cannabis being legalized in New York. And very unfortunately, part of the problem is that OCM is not adequately keeping statistics, like they're not keeping the data. So really what we have are fundamentally 2 pieces of data. We know about the cultivators. We know all of the 300 odd farmers who have received licenses across New York State. And we know in like this drip by drip way who all of the dispensaries are. One of our early hypotheses would be, and this was based on our study in local food systems, we were hoping that areas in New York State that were historically ag counties, for example, would be able to take advantage of this licensing, and it would be a new kind of, this time, legal cash crop. We're actually wrong, like pretty much what we found out, and that's indicated on this chart. So the darker the blue, the more cannabis producers. They're often sort of clustered in the lower Hudson Valley, and the variable that tends to be more important, and maybe you're smarter than me and you already came up with this, is socioeconomic status. So the wealth of the county actually determines who's growing cannabis and who's able to get it to market. And on the right, is one of the, this is, we this is sort of one of the, how shall I say this? This is one of the charts that actually encouraged us to dig a little bit more deeply into this. So there's been, as you probably heard from the news, very, very few legal retail dispensaries that have received licenses. On the other hand, the illegal market has grown tremendously. So we kind of wondered why. And one of the aims of our early work was to figure out why, if there had been any evidence of like policy learning over time. And there's actually no reason why we should not have learned. As is indicated on this chart, somewhere around the mid-90s, California became one of the first states to legalize. It took a long time, and that was strictly medical cannabis. And then by the early 2010s, lots and lots of states sort of jumped on board. So I wanted to tell you quickly a couple of stories of how other states have handled this, because it's actually kind of intriguing. So California was the first in the US. They had historically prohibited the use of marijuana from, the 30s onwards. However, they're also sort of the site of the counterculture, right? And they also have strong counterculture roots. So it's not unusual, I think, that in a place like that, it would be the first to legalize. So in '96, California began to legalize with medical. They did this with Prop 215. It led to decades of tumultuousness in the policy arena, trying to figure out how to create a framework that would work across the markets, across different populations. In 2016, Prop 64 legalized recreational cannabis. And interestingly, the sort of outcome of this is we can say that since then, they faced some pretty serious problems. The taxes on cannabis are really high. There was this achingly slow licensing process. And there is this obvious persistence, right, of an illegal weed market, because it's really expensive to be a legal, marijuana dispensary. And we've never done anything to really address that. And the state licensing actually, made it a lot worse. My partner at RPI and I really kind of love Massachusetts for one very specific reason. They actually give us their data. So if you were to go onto Massachusetts website, they do a fabulous job of providing lots and lots of data about their dispensaries, everything from like basket size to locations within municipalities, the average profit of each store, time in operation, the kinds of strains that are sold, the types of products, how many people they get through the door every day. This is unusual, we found. In New York, despite the fact that we have been a leader in open data access across a number of disciplines, we're not doing so good when it comes to cannabis. So that's a good reason why we've actually loved dealing with Massachusetts. They legalized in 2012, same year as earlier than a lot of them. But so let's see, there were I think we could say easily that there were growing pains from the beginning. They did something similar as a lot of other states did. They first legalized medical use of marijuana and then moved over to recreational in 2016. This kind of led to a wave of interest. We won't say necessarily consideration of policy, but an interest in the Northeast in whether or not we should move forward with legalization of cannabis. They tended to, much like us, focus on consumer safety, on things like education. But, and this is a story that you're going to hear constantly, but we had trouble with slow licensing in Massachusetts. There are also incredibly high startup costs. I don't know if any of you have actually walked into a dispensary in Massachusetts, but these are like heavily fortified locations, right? With a lot of requirements when it comes to how you design and actually construct a cannabis dispensary. And there's also something that we have not addressed in New York, but is also important and kind of led this work. There's also some local level restrictions. So Massachusetts provides some ability for the localities to say no. We've done the same thing in New York State. So I think at this point it's sitting somewhere around 50-50. We have about 50% of municipalities in New York State who opted out of allowing dispensaries. Massachusetts did something pretty similar. The last time I looked at the data, I'll leave you with this last note as well. Interestingly, and maybe not interestingly to me, but maybe you'd hypothesize this. So there tends to be huge clusters of cannabis distribution in places like Boston, right? And some of the other townships, either because they've opted out or because it's just too expensive for more rural places in Massachusetts to do this, they have far fewer of them. And there has also been some pushback. So one of the more recent interesting pieces we got out of Massachusetts is that they've seen a decline in the number of licenses. I don't know, I'm not an economist, but I often play one. I mean, this is a bad thing for a market. I mean, some would argue that it's actually just removing the weaker facilities and putting them out of business. But it should be of some concern to their version of their cannabis control office that there's a decline in the number of licenses. So I wanted to return to New York State. I thought this was this is the kind of quote that when I show to people, they tend to sort of grumble. So one question that we had from the beginning, and that was why I showed you that graph over time, that series of implementation of across states. Did we know what we were doing? Like, did we attempt to mimic and craft our policy based on the lessons learned from other states? This is a quote from Chris Alexander of our OCM in New York State. He has since resigned, but he had said it's not that we know the perfect way to design or implement a cannabis market. Who do we turn to know the way to do this? It's just us. And we're not even close to where we need to be to handle all that we're trying to do. So a couple of things come up for that. You know, I mean, I think our cannabis control office in New York State has been achingly clear that they never had the capacity to be able to address all of the issues that are important for New Yorkers when it comes to cannabis. So we have not done a very good job with regard to safety. The lab piece of this is the lab infrastructure is still far less resourced than it needs to be. And they have literally thousands of applications that they haven't gotten to. Interestingly, I recently talked to a cannabis operator, somebody in the policy world of cannabis in a different state. And he had I thought, a really interesting point. He said something along the lines of, this is government. Like, how quickly did we really expect it to be able to act? And I think that's probably a really good point. I mean, a lot of the institutions that we've crafted are designed to move slowly. So we're really not set up a market from go, right? It's definitely going to take a while. So how did we map this out? I think from the very beginning, we thought, well, some of this is pretty straightforward. The growth in legal cannabis is driven by a price advantage. If that price advantage doesn't happen, if the product is cheaper on the illicit market, then it is no surprise, right, to anyone that there's going to be there's not going to be much attractiveness in heading over towards the legal cannabis operations. Additionally, price competition, right? This is exacerbated by these kind of regulatory hurdles that we've layered on top of potential cannabis applicants, and the very high startup costs involved in doing this. This certainly has driven a lot of people from the legal cannabis market. But it is actually even more complicated than that, right? So we added a few more moves to this that I want to talk about. There has been first this cultural shift when it comes to cannabis. This is not news to anyone on this call, right? So the sort of zeitgeist of cannabis in New York State and elsewhere is that people are no longer all that concerned about the health implications of cannabis. There's also not a cultural, there's more of a cultural shrug, right, when it comes to to using cannabinoid substances. And this is new, right? This is kind of a change. What that meant, well, it meant two things. I think first, we expected law enforcement to do something about the illegal market. And of course, if you change the laws and reduce any sort of policy impetus to shut down these facilities, law enforcement had, you know, their capacity removed, and they no longer cared very much because the culture said this is okay. What that had led to was a tremendous rise in the amount of illegal activities, particularly in places like New York City, and very little capacity to change that. So the one thing in light of that loop that I think New York State has done, and this is a huge change since when I first spoke about this past summer, is that we did invest more in law enforcement. I find this an intriguing part of this study because I'm morbidly curious about whether that was a one-time piece of funding where we're going to boost enforcement for OCM to shut down illegal operations, and whether they'll be able to sustain that. Because in some ways, this is a whack-a-mole phenomenon, right? We're going to shut these down and then they kind of pop up again somewhere else. From what I've heard, it has been moderately effective so far. There's far fewer illegal cannabis operations in New York City in November of this year than there was in March of this year, which I think is interesting. There's also another loop that I haven't really spoken about much yet. There is this testing loop. So legal cannabis buyers are more likely to use legal facilities if they feel like they can trust it, that there has been some testing behind, right? You're buying a product that you can rely on. It's not going to kill you. You're not buying it from a dime bag from the corner, right? That was supposed to be an encouragement. That was supposed to make legal cannabis a whole lot more approachable for people because they can say it's legal, it's coming from this place that has this lab stamp on it. However, if we don't do a good job of creating the lab infrastructure, then it's going to create a whole number of issues down the line. The biggest of which is you know, we don't have enough product from New York State that's actually been approved and can sit on shelf. So those are two big problems that I wanted to address. There's another one that I haven't really spoken about, but is actually pretty important. So we had this great idea first. I have to tell you, I have all these notes, and then generally I just sort of talk off the cuff, right? And then I miss all of the stuff that I wanted to tell you. However, New York State had a great idea, I thought, to begin with. They said, we care about public health and public safety. We're going to tax products in proportion to how potent they are. So the higher the potency, the higher the tax. It would be more expensive products for people to buy, and therefore they would be sort of, you know, pushed pressure towards lower potency products. What we have, all of us like collectively have discovered is that actually consumers continue to demand higher and higher potency products, and they are willing to pay for them. That does two things. First of all, it's going to reduce the market share for those small craft producers. Most of this very, very high potency product is actually produced by those big registered organizations. And small craft producers can't compete with that. And New York State actually thought we're going to make a lot more tax dollars potentially if we remove this very complicated layer of bureaucracy and stop trying to figure out how we're going to create a higher tax for higher potency products. So earlier this year, we completely eliminated that piece of New York State legislation. So my team is always really interested in what the policy impact would be. So first and foremost, the dynamics here kind of illustrate something important, I think, right? That we can actually predict a good portion of this. So we can conclude that the legal market continues to exist. In many, many cases, it means that it's thriving. And this is despite the fact that one of the stated reasons behind legalization of rec was to make the illegal market irrelevant. That hasn't happened at all. What essentially we've said is that we're going to make it cheap to operate in an illegal environment. And we don't really have the enforcement to prevent that. Additionally, I think there's some goal misalignments. So what is exactly the problem? So in some cases, these goals are working against each other. Creating from scratch an entire market was always going to be difficult. It was a task that was going to require time and investment and possible policy efforts. And we would also say that some of those delays could have been mediated. In some cases, some of those delays probably should have been anticipated, and we didn't. On the other hand, I completely agree with my colleagues several states over who said this was too big of an ask maybe to make of a very small state agency. And the fact that then people were very, very angry with how the rollout happened is kind of a little strange, right? I mean, we make these big asks of people and then don't give them the capacity to actually do it. So those were sort of our bottom line. I love that in the background you can see that it's a lost cause. So that was exactly what we thought to begin with, but actually we've amended that slightly to say enforcement activities is probably going to fluctuate over time. That honestly, there's going to be an increasing pressure to act if places like New York City start to become very uncomfortable with the level of illegal activity because of these pot shops popping up. And then it will be handled, and then I'm pretty confident that some of that initiative will then dry up because we will consider the problem solved. Law enforcement is still not really particularly eager to help in this regard, and it's mostly the OCM, this our Office of Cannabis Management, that's going to be doing the enforcement. So also potency will continue to rise. I have a link down below this that my colleagues begged me not to leave into this presentation, but I find this utterly fascinating. So if I sent Rachel my slides, if you go, I won't go there now just because I have people behind me. But if you go to that link, part of the problem in creating place-based, jurisdictionally bound markets is that in this day and age, you can buy whatever you want on the internet. So you can buy extraordinarily high potency products online and have it shipped to your house. I think this means something very concerning. There's actually an article in the New York Times yesterday indicating some of the changes in use levels of marijuana among different areas of the population, right? So surprisingly, teens are not using marijuana at all more, which is probably because those dispensaries often look like Fort Knox, and maybe they're not aware of the illegal ones. On the other hand, high potency products are concerning, and the potency levels continue to increase. So I wanted to talk to you just for a little bit. How much time do I have to talk to you? So I don't want to take up too much of your time. We have been this is what I do. I don't know if any of the rest of you do this for a living. So I think of myself as faculty, but really what I am is a director of development, right? I just beg for money wherever I go. So we've been attempting to actually get funding for this work for 2 years now. It shouldn't be any surprise to any of you that actually we have not succeeded in finding funding, but we had a proposal go out to the USDA last week. I wanted to point out that one of the ways that we've changed our work with regard to this slightly is that we're how to say this in a way you'll completely understand. We're changing our interest in this to get a little bit of funding to study some important problems. So we care about cannabis. We're treating it as a novel technology, believe it or not, for NEPA, and we're going to see if we can figure out ways to get funding to then study the policy problem a little bit more in depth. So we get to ask questions like, does having these kinds of regulations in a market, is that predictive of a more stable market? Is there a way of actually integrating social equity into the market itself and doing it in a seamless fashion? Is this ever going to work? And questions like that. So I wanted to point those things out. We're also doing some economic modeling. So my colleague at RPI is actually much more focused on understanding the degree to which cannabis is going to be an economic driver for some of the localities that have agreed to allow rec on their main streets, right? And I think the jury is still out because there's there's still a tremendous amount of pushback. I don't think there's a lot of people who are eager to have a marijuana dispensary next to, like, you know, the general store. So yeah, so I think that those are the kinds of questions we're really looking forward to trying to address. One last one, and this is maybe also one that I kind of get myself in trouble about, and I'll say that this to me has become even more important after Tuesday's election. So our study has had some ripple effects into other projects. Like normally I'm talking about regional food systems and rural innovation and issues like that. But we really do care about whether we're capable of creating markets from scratch. If we needed to, could we do that? And this is because I care about the fact that we're actually in a lot of trouble with regard to numerous issues, not the least of which is that we're going to need at some point to reduce our energy consumption, and we're going to face the consequences of climate change. And you're probably wondering, like, how on earth does this relate? Well, what we've discovered, I swear it relates, is that there are actually a bunch of case studies that we selected, one of which is this Corona Plaza example, where it's become more viable over time for people to form illegal markets. And I don't know why that is. I mean, I have some hypotheses about why that is, but I kind of want to know if that represents any kind of interesting transition to less regulated markets, to more community-based markets, to more localized markets. How are we going to govern those things? And what lessons can we learn about how to navigate increasingly uncertain times gracefully, we'll say. So those are things that I think have also come out of this project, which were pretty unexpected. I love talking about this stuff. I'm sorry to have kept you like 40 minutes or whatever. And I'm happy to answer any questions.
Awesome. Thank you so much, April. That was so interesting. Eric had a couple of questions in the chat, so maybe we can look at those first. So his first question, unless if Eric, are you able to come off of mute and ask your question? Okay. I can also just, okay. Oh, he left and maybe came back. I think he's here though. So I guess the question is, do public consultations on adult use on marijuana ever get denied and then approved? And if so, can you provide some insight on how that approval occurs after an initial denial?
I have no idea. I think part of the problem is so few have actually been approved. So of the thousands that are waiting in line, we have 222, I think is the number as of like this month, but I could be a little wrong on that. I mean, I think New York State was expecting, like, at day one, we would be able to like start issuing licenses, but we've created a very complex system to actually do that. And it takes a lot of time and effort to actually go through each one of those approvals. To assume that if you're denied an application and you're given a review of why you're able, I can see no reason why you wouldn't be able to come back and then reapply. I wish I knew whether that answered his question though.
I know. Eric, if you are satisfied, please indicate. Oh,
I'm sure I understand the second question. So it tracks.
I think it was related to a specific slide, but I didn't really catch what slide that was.
You know, I can say very broadly that the attractiveness is an intriguing concept to us when it comes to like legal, like what are legal buyers drawn to versus illegal buyers, and in this way, our team is no different from New York State. Like New York State is desperately trying to figure out how we make the legal dispensaries more attractive to people than the illegal ones. But unfortunately, that is a tough nut to crack, right? Because you know, the startup costs in some ways are fixed, right? We want to make sure that that we're creating dispensaries that are and it's just like, you know, alcohol and creating liquor stores. You have to follow certain guidelines. So the startup costs are high, and the regulations, the taxing on cannabis is also high. So it's hard to make the argument other than on the basis of legal dispensaries offering safer products.
I've got a question. Can you hear me all right?
I can hear you. Yeah.
I was wondering if you have considered the effect of home growers, since it's legal to grow it yourself in New York State. I mean, does that have a big impact on the market, or does it not have any effect at all, or do you have any idea?
I think we don't have much of an idea, because the ability to grow yourself has only come out fairly recently. So we have very little data to start with. And second, it's only been a recent approval. So we had the law be approved, and then we had to go through a whole series of additional regulations and rule changes in order to actually allow people to grow. So it's sort of curious. Like, I think this past summer was the first time when people could legally start to grow. I think it was like 3 adult plants per household, right? And 3 adult plants per person and 6 per a household. So
something like
I don't know. I mean, Richard, do you think people are that that enthusiastic about the product that they're willing to grow it themselves? I don't know. I'm a little.
Well, it's not very hard to grow. It's as easy to grow as tomato plants. I mean, where I live, you just have to put them out a little, you know, grow them in pots first. I've actually been growing it for 3 years, so I guess the first year I was illegal. But you know, the information was very hard to get.
Yeah.
I mean, you really had to search to see what the rules were, and then the rules quite often were listed as what they were going to be rather than what they actually were. So when you tried to find out what the rules were, it said, "Oh, this is going to be the rules," but it wasn't the current rules. So they've changed it, and other states have had the same problem. But I was curious about that. The other thing I'm wondering about is where they grow. My understanding is that upstate New York is also a place where they're thinking of growing industrial hemp. You know, it's the same plant, but it doesn't have THC in it. And if people are growing marijuana nearby, then that can get into the industrial hemp and then make it illegal because the THC levels are too high, more than 2% or whatever it's supposed to be for industrial hemp. I don't know how big that effort is to grow industrial hemp, and I don't know if you're growing mostly female plants, maybe there's not that much pollen in the air anyway. So, but it is a wind pollinated crop, I believe.
I'm having like a hard time hearing you. I'm so sorry. It's gotten like a lot louder here recently. Rachel, could you is there a question I should answer? I'm so sorry. It's gotten so loud here.
Can you hear me okay?
I can. I don't know why I can hear you better than everyone else, but.
Okay. Richard, did you have a specific question? Because I think it was more like a comment, right? About the.
Well, yeah, I was wondering about the effects of homegrown, which can affect the market. You know, if a lot of people decide, hey, this is easy to grow, I'm going to grow my own, and they may give it to neighbors. And I also wonder about illegal sales from homegrown. I mean, can happen. It's pretty expensive, and I mean, it's very cheap to grow. I just don't understand why the market isn't doing much better. Probably because the prices remain high. I really don't. Anyway, that's.
Yeah, no. And actually, Richard, I'm fascinated by this as well. And this is our reason for really being intrigued by things like the Corona Plaza example, where we have markets just sort of bubbling up, or the fact that there were so many illegal operations happening in New York City. And I know that at first blush, we should be shocked at all of the illegal activity. I kind of feel like, what if this is a solution to the fact that cannabis is so expensive? And of course, this is a natural reaction. And I know where I am in upstate New York, I mean, and this isn't a change over the last 5 decades, right? Like, so there is a tremendous amount of people who grow marijuana and they give it to their friends, right? Like, I think that sort of low level illegal activity will continue. And I don't really know what impact it might have on I can tell you though, if you guys have time for another slight diversion, a much bigger concern to me is the fact that cannabis is also able to be manipulated. So that link that I gave you to that Earth Wellness site, they're claiming to be selling what is essentially high potency cannabis, and it is THC, but they're considering it completely legal. But they're and those of you who are like biologists out here are going to be shocked at my butchering of this language, but we're essentially changing some part of THC, right? To make it's doing the same sort of thing, but it's now considered in some gray area, not illegal. They can ship across state lines. They're shipping it online. It can go anywhere, and it's incredibly high potency. And we actually don't, this isn't the same weed that you would get when you're in high school behind the auditorium, for Christ's sake, right? This is like really serious stuff, and we don't have very much literature at all to support whether or not people should be ingesting that or smoking that on a regular basis.
Yeah, I was surprised at how strong it is. I mean, when I first tried some that I grew, I was shocked that it's
with your homegrown stuff.
My homegrown stuff, yeah, it's pretty darn potent. I mean, anyway, it's neither here nor there, but I was surprised that it's that strong and that it was made legal. I mean, I was in favor of being made legal, but I was surprised when I tried some. I hadn't used marijuana for years, or hardly ever in my whole life. But yeah, it's pretty darn strong.
And an additional concern, right, is that it can be placed in things like edibles, right? So it makes it a little bit scarier to me that people can take 8 edibles and be in not a good place for a very long time, because this stuff is very, very potent.
Yeah, it lasts a long time when it's in edibles.
Yeah.
I think Wayne, you have a question or comment? Have your hand up.
Yes, I was just. This topic is fascinating to me, but what I wanted to plug in was back to system dynamics. You showed us a couple of interesting little diagrams, and my question is, can you understand? Can you hear what I'm saying?
You kind of slowed down and sped up, but I think you're okay now.
All right, I'll talk slower. My question is, are the opportunities for useful learning from the system dynamics method early in the process, where you are right now, which is you've got some basis of a lot of material collected, or is it later when there's more data available? And I just wonder what your thoughts are about the opportunity for system dynamics to be a value add in your research.
Okay, April said she can't hear very well, so I'll just repeat, I think, what Wayne said. So the question was, where do you see the benefits of using the system dynamics modeling method along the process? So you've shown kind of using it kind of early on in the process, but do you think it would be more useful later on when you have data to do more formal policy analysis? Like, what are your thoughts on that?
Yeah, so the goal is simulation, right? So the goal is always simulation. I hope the goal is always actually building simulation models. This is more of maybe an overarching concern about system dynamics. So in order for me to engage in the kinds of work that I want to do, so do simulation modeling, be able to talk to lots of stakeholders and be able to really understand better the dynamics of this requires me to figure out how I buy myself out of either teaching obligations or other things in order to do it, and no one's really willing to fund cannabis right now. So I'm in a sort of hard place where I'm like, yes, the goal will be to do an actual formal system dynamics model. And we're hoping to be able to create something that allows us to compare different policy initiatives over different landscapes. So we've chatted with some folks from Ohio and chatted with some folks from Washington State, and Matt, who I met in Bergen, is in the Netherlands, right? And he has an interest in Portugal. So we want to be able to create something that is simple and small enough that we can test different policies and understand how the economic landscape might change. That's sort of a big goal, and I can't do it unless I have more time, and that means even a little bit of money to be able to do that.
Jack, yeah, go ahead. I see your hand. Try to as loud as you can for April, because I think she's having a hard time.
Good, April, can you hear me?
I can hear you. Yeah, go ahead.
Okay, great. I was curious about learning from other states and learning from other research that's been done previously. So your OCM colleague said, we're on our own here. We can't learn from the other states. And I didn't understand that comment. And then, and there has been some very good research done over the years, like by the people at Rand and UCLA, who were instrumental in setting up the Washington State cannabis program, and a lot of lessons learned and a lot of research papers written, and they're economists by and large, but they're also operations researchers and other kinds of modelers. So is that a good foundation, a good starting point for your work?
Yeah, absolutely. And I would love to speak to his comment as well. I mean, whenever I share that comment, people groan. They're like, how could that be true? Like we've had this long history of legalization efforts. But I also think simultaneously, like maybe this is some sort of paradox, right? So simultaneously, what is also true is that we might know about those lessons, but they, maybe because of the political environment, we're utterly unable to then implement them in a way that was acknowledging those lessons learned. And that, I mean, that to me is an intriguing policy problem, right? Like, why is it that we thought we learned, but then when it came down to it, we actually didn't invest in the kinds of resources, make sure the damn agency is big enough to actually like be able to do the things you asked it to do. I mean, that's not even a cannabis learning. That's like a basic public administration learning, right? But we missed that. And it's kind of interesting, right? From a scholarship perspective, like, well, why were we so eager to just get it approved and say we're implementing it? We didn't care so much about the outcomes. I mean, if that's true, that's pretty goddamn shocking, right? So I don't know. Yeah, I think that those are all good. What I found recently over the last, like, say, at least the last 10 years of literature, much more of it seems to be focused on the public health end of cannabis than the economic implications of transitioning markets. So I'll have to look harder for those papers by economists, because I'm kind of curious.
Sounds good. Thanks.
Yeah, thank you.
Any other questions, comments? I have one. So it seems to me like we want to figure out a way to incentivize legal cannabis, and maybe just like moonshot, maybe like some sort of subsidy or something to decrease the price of legalized cannabis to make it more competitive against illegal. But would you foresee some policy like that having unintended consequences? Because I have thoughts about what that would do.
I don't think they would ever do it. So the impetus behind legalization, Andrew Cuomo was not a supporter of cannabis legalization for years and years and years and years, and then he needed tax dollars, and suddenly he was a supporter of legalization. So from the very beginning, there's been a broad acknowledgement that we did this because we were interested in the revenue. It was annoying to people that California has a surplus of cannabis. It often ends up in illegal shops in New York City. Why are we not taking advantage of this potential windfall, right? I mean, it's kind of crazy, but under no circumstances do I think they'll ever subsidize making this cheaper, right, than the stuff on the street. Generally speaking, they just want to try to remove the stuff that's being operated illegally. I mean, sadly,
Sure.
it doesn't help our small farmers. Like,
Yeah.
for years we've been saying these people threw in like life savings to try to get licensing and sell recreational weed, and they're losing farms. I mean, if you do I didn't want to spend too much time talking sadly about the loss of small farms in New York State, because God, everyone's sick of hearing me say this, but like cannabis farmers are in just as dire straits as anyone else.
Yeah. I guess this is where system dynamics can be so powerful. Like if you can show like the unintended consequences of this slow, crappy rollout are to further incentivize and fuel the growth of the illicit market, then maybe that's like a starting point for a conversation around like more progressive policies around like pricing.
Yeah, no, I think you're right. I think that sometimes the value I see in using modeling is that it opens up the space for conversation around things we wouldn't have talked about otherwise.
Yeah.
Right. So yeah, I agree.
All right. Any last thoughts for April?
Well, I just really appreciated your comment about the problem of trying to achieve multiple goals at the same time. Equity being one, and limiting the public health adverse effects and so forth. And this may be where New York is different from other states, because, and maybe this is just an Albany kind of thing, because I'm in upstate New York also, of trying to do too much at once and then not being able to do anything at all. So I liked your comment on that.
Cool. Thanks. Yeah. I mean, policy is my first love, so these are the kinds of things that, like, my school used to be very good at. We were good at integrating decision making and judgment and system dynamics, and coming up with really interesting policy insights. So maybe we'll get back there. Fingers crossed.
Awesome. Well, thanks so much, April. This was a really great presentation, conversation.
Thank you so much for offering. Yeah, thank you.
It was awesome. So everyone on the call, our next health policy SIG meeting is December 5th. It's going to be at 11 a.m. Eastern, and we're going to hear from Jose Mazariego. He's going to be presenting on doing some modeling of HPV vaccination among adolescent boys, also in New York State. So we're getting like a nice focus on New York State projects this fall. So that's exciting. So watch out your emails. I'll send you information on that in the next few weeks. All right. Thanks again, April. I hope everyone has a great afternoon.
Thank you.
Thanks. Bye-bye.
Thanks.